we're going to talk about iodine in a minute. The most important thing you should remember with respect to iodine is always thyroid hormone synthesis. Let's learn a little bit about it as a mineral. So its most important function is that it's a component of thyroid hormones. What are the dietary sources? Saltwater fish. So this is important. It's saltwater fish and iodized salt. Now iodized salt does not occur naturally in nature. It has to be fortified. Salt has to be fortified. What does the deficiency lead to? It can lead to hypothyroidism and it can lead to formation of a goiter. So in those who live in iodine deficient areas, so it can be any part, so it's usually central India, for example. These areas have soil which is very poor in iodine, and if they don't have access to iodized salt, they're going to have an iodine deficiency and they are found to have goiters. Now, how do you prevent this? Prevention is by iodization of salt, and treatment is also by consumption of iodized salt. Now, the irony of iodine is that its excess can also lead to hypothyroidism because it inhibits the enzymes involved in thyroid synthesis, and it can also lead to formation of a goiter.